In general, a rural area or countryside is a geographic area that is located outside towns and cities. The Health Resources and Services Administration of the U.S. Department of Health and Human Services defines the word rural as encompassing all population, housing, and territory not included within an urban area. Whatever is not urban is considered rural. Typical rural areas have a low population density and small settlements. Agricultural areas are commonly rural, though so are others such as forests. Different countries have varying definitions of rural for statistical and administrative purposes. North America, Canada. In Canada, the Organization for Economic Cooperation and Development defines a predominantly rural region as having more than 50% of the population living in rural communities, where a rural community has a population density less than 150 people per square kilometer. In Canada, the census division has been used to represent regions, and census consolidated subdivisions have been used to represent communities. Intermediate regions have 15 to 49% of their population living in a rural community. Predominantly urban regions have less than 15% of their population living in a rural community. Predominantly rural regions are classified as rural metro adjacent, rural non-metro adjacent, and rural northern, following Aarons and Beeman. Rural metro-adjacent regions are predominantly rural census divisions which are adjacent to metropolitan centers, while rural non-metro-adjacent regions are those predominantly rural census divisions which are not adjacent to metropolitan centers. Rural northern regions are predominantly rural census divisions that are found either entirely or mostly above the following lines of parallel in each province: Newfoundland and Labrador, 50th, Quebec 54, Ontario, 54th, Manitoba, 53rd, Saskatchewan, Alberta and British Columbia, 54th. As well, rural northern regions encompass all of the Yukon, Northwest Territories and Nunavut. Statistics Canada defines rural for their population counts. This definition has changed over time. Typically, it has referred to the population living outside settlements of 1,000 or less inhabitants. The current definition states that census rural is the population outside settlements with fewer than 1,000 inhabitants and a population density below 400 people per square kilometer. United States: 84% of the United States' inhabitants live in suburban and urban areas, but cities occupy only 10% of the country. Rural areas occupy the remaining 90%. The U.S. Census Bureau, the USDA's Economic Research Service, and the Office of Management and Budget have come together to help define rural areas. United States Census Bureau. The Census Bureau definitions, which are based on population density, defines rural areas as all territory outside of Census Bureau-defined urbanized areas and urban clusters. An urbanized area consists of a central surrounding areas whose population is greater than 50,000. They may or may not contain individual cities with 50,000 or more. Rather, they must have a core with a population density generally exceeding 1,000 persons per square mile, and may contain adjoining territory with at least 500 persons per square mile. Thus, rural areas comprise open country and settlements with fewer than 2,500 residents. Areas designated as rural can have population densities as high as 999 per square mile or as low as 1 person per square mile. USDA *. The USDA's Office of Rural Development may define rural by various population thresholds. The 2002 Farm Bill defined rural and rural area as any area other than a city or town that has a population of greater than 50,000 inhabitants, and the urbanized areas contiguous and adjacent to such a city or town. *. The Rural-Urban Continuum Codes, Urban Influence Code, and rural county typology codes developed by USDA's Economic Research Service allow researchers to break out the standard metropolitan and non-metropolitan areas into smaller residential groups. For example, a metropolitan county is one that contains an urbanized area, or one that has a 25% commuter rate to an urbanized area regardless of population. OMB. Under the core-based statistical areas used by the OMB, *, a metropolitan county, or metropolitan statistical area, consists of central counties with one or more urbanized areas and outlying counties that are economically tied to the core counties as measured by worker commuting data. *, non-metro counties are outside the boundaries of metro areas and are further subdivided into micropolitan statistical areas centered on urban clusters of 10,000–50,000 residents, and all remaining non-core counties. In 2014, the USDA updated their rural, non-rural area definitions based on the 2010 census counts. Rural Schools National Center for Education Statistics revised its definition of rural schools in 2006 after working with the Census Bureau to create a new locale classification system to capitalize on improved geocoding technology. Rural health definitions can be different for establishing underserved areas or healthcare accessibility in rural areas of the United States. According to the Handbook, Definitions of Rural, a handbook for health policymakers and researchers, residents of metropolitan counties are generally thought to have easy access to the relatively concentrated health services of the county's central areas. However, some metropolitan counties are so large that they contain small towns and rural, sparsely populated areas that are isolated from these central clusters and their corresponding health services by physical barriers. To address this type of rural area, Harold Goldsmith, Dina Puskin, and Diane Stiles described a methodology to identify small towns and rural areas within large metropolitan counties that were isolated from central areas by distance or other physical features. This became the Goldsmith modification definition of rural. Boom! Rural education. The Goldsmith modification has been useful for expanding the eligibility for federal programs that assist rural populations, to include the isolated rural populations of large metropolitan counties. Healthcare delivery in rural areas of the United States can be challenging. From 2005 to 2011, the rate of potentially preventable hospitalizations for acute conditions was highest in rural areas. Europe. Germany. The country is divided into 402 administrative districts, 295 rural districts and 107 urban districts. Germany is among the largest agricultural producers in the European Union. More than half of Germany's territory, almost 19 million hectares, is used for farming, and are located in the rural areas. Almost 10% of employees in Germany has work linked directly or indirectly with the agricultural, forest and fisheries sectors. Approximately a fifth of them are employed in primary production. The implication is that, unlike in some other European countries, where rural areas are known for being backward when compared to urban areas, in Germany, the trend is changing. Due to the country's policy of equal living conditions, this is not the case in Germany. Rural areas receive nearly equivalent attention as the urban areas do. Also, through a special approach to rural development, usually referred to as village renewal, the challenges of rural Germany are taken care of. Ireland. Ireland is traditionally seen as a very rural country, despite its many vibrant and urban centres. Agriculture is an important part of the country's economy. There is a varied rural landscape ranging from bogland to green meadows and hills to rugged mountains. United Kingdom. In Britain, rural is defined by the Government Department for Environment, Food and Rural Affairs, using population data from the latest census, such as the United Kingdom Census 2001. These definitions have various grades. but the upper point is any local government area with less than 26% of its population living in a market town. A number of measures are in place to protect the British countryside, including green belts. Rural health in England. An NHS patient is defined as rural if they live more than 1.6 kilometres from either a doctor or a dispensing chemist. In Scotland, a different definition of rural is used. This is important for defining whether the patient is expected to collect their own medicines. While doctors' surgeries in towns will not have a medicines dispensary, instead expecting patients to use a high street chemist to purchase their prescription medicines. In rural village surgeries, an NHS medicines dispensary will be built into the same building. Asia. India. Rural areas are also known as countryside or a village in India. It has a very low density of population. In rural areas, agriculture is the chief source of livelihood along with fishing, cottage industries, pottery, etc. The quest to discover the real rural India still continues in great earnest. Almost every economic agency today has a definition of rural India. Here are a few definitions. According to the Planning Commission, a town with a maximum population of 15,000 is considered rural in nature. In these areas, the panchayat takes all the decisions. There are 5 people in the panchayat. The National Sample Survey Organization defines rural as follows: an area with a population density of up to 400 per square kilometre. Villages with clear surveyed boundaries but no municipal board. A minimum of 75% of male working population involved in agriculture and allied activities. RBI defines rural areas as those areas with a population of less than 49,000. It is generally said that the rural areas house up to 70% of India's population. Rural India contributes a big chunk to India's GDP by way of agriculture, self-employment, services, construction, etc. As per a strict measure used by the National Sample Survey in its 63rd round, called monthly per capita expenditure. Rural expenditure accounts for 55% of total national monthly expenditure. The rural population currently accounts for 1/3 of the total Indian FMCG sales. Pakistan has also a large population living but in rural areas. Some rural areas are now developing as well.